All right, so thanks everyone for being here today. As I mentioned, I'll be talking about wellness in the context of this crisis. And the overarching message that I think it's important for everyone to have is that what we're embarking upon now is a marathon, not a sprint. And therefore, it's really important to take care of yourselves and each other. So I wanted to start out with this quote from Viktor Frankel, uh, uh, who was a psychiatrist, and he lived during the Holocaust. And he wrote a book called Man's Search for Meaning, which was really informative to me when I started um, doing psychotherapy. And the most important quote I think that came out of that book was that everything can be taken from a man, but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. And I think this is really important during times of crisis to recognize that while everything is changing around us and there's a lot of uncertainty about what will happen and in the near and long-term future, that it's up to us to maintain a sense of hope and optimism, and that might falter at times. And I think it's really important that we help each other find that sense of hope and optimism as well. So as I was thinking about preparing for these talks that I'm giving now, it was a little difficult because, I think this is a really unusual time for all of us. And I clearly am not an expert in, managing stress during a pandemic. So I looked to literature to help me figure out, what tools might be helpful to those of us on the front lines. And it's reassuring to know that is a literature to guide how we can take care of ourselves and each other during this time. And I think one of the biggest things that we can do is to cultivate a sense of flexibility because things are rapidly changing. As I'm sure you've seen, we get new directives almost by the hour about how to manage different aspects of taking care of our patients and policies at the hospital. So I think it's important that we all think about cultivating a sense of psychological flexibility. And the type of therapy that I practice, acceptance and commitment therapy, has a model for cultivating psychological flexibility. And it's not important for you to know the model or even spend much time with this, but I just wanted you to know that this is guided by an evidence base. So the first part of this is to get present. So in modern parlance, this is called mindfulness. Mindfulness, the term carries a lot of weight now, and a lot of people think of it as like new agey, hippy dippy stuff. But really, all it means is to get into the present moment. And there are a number of different ways of doing this. But as you reflect on your thoughts in the last few days, maybe the ones that make you feel most worried or anxious, you'll notice that they're all about the future. What might happen next? What will happen to me? What will happen with my family? And as your thoughts get focused on the future, you may notice that sense of anxiety going up and up. And it can be really hard to break out of that cycle because one anxious thought often leads to the next, and so on. So one tool for escaping from that cycle is to bring yourself back into the present moment. Because right now, for the most part, we're all okay. Everything is okay here, right now. So there's one really simple exercise that I'll teach you right now to get back into the present moment when you notice yourself feeling anxious or frustrated about your current situation. And the idea is not that you would necessarily put up blinders and pretend that, anxiety provoking or frustrating things are not happening, but instead the idea is to get back into the present moment so you can break out of that cycle of anxiety and meet the demands of the day or the demands right in front of you with a more clear head. So this exercise is called the five senses exercise. I like to teach this one first because it's really simple to do. And so what I want you to do now, if you're willing, is to do this exercise with me. I want you to look around the room that you're in and notice what you see there. Notice where the door is, where the window is, if there is one, where the light is, where you're sitting. See if you can find anything in the room that's red. Just look around and sort of catalog all the things in the room that are red. Now do the same thing with a different color. Let's pick purple. Is there anything purple in the room that you're in? Next, I want you to listen to the sounds that you hear. You can hear my voice. You can probably hear some other things too. Sometimes it's helpful to close your eyes. Next, smell the scents in the room. Take a few breaths in through your nose. And see if you can smell anything there. Taste the flavors in your mouth. Try and focus your attention there for just a second. Maybe you notice the taste of toothpaste, the coffee that you were drinking earlier. Next, feel the air on your skin. Does it feel cool or warm? Notice the places where your clothes touch your skin. See if you can hold your attention there for just a moment. And so now you've contacted the present moment through each of your five senses. And you can do it anytime, anywhere, without anyone really noticing. You can do it as quickly as you'd like or as slowly. And whenever I do this with my patients, they almost universally notice that whatever anxieties or distressing or disturbing thoughts they were having sort of fall away in the moment when they're doing this exercise. And like I said before, it's not to suggest that they would go away completely, because that's totally unrealistic. But the idea is to just be able to calm yourself, your body and your mind, to get back into this moment so that you can face the day with a clear head. The other thing I'll say about mindfulness is that it's sort of like a muscle. The more you exercise it, the stronger it will be. So you wouldn't try to run a marathon by, exercising the morning of. Instead, you would practice over time. So I would suggest starting now with a daily practice of mindfulness of some sort. You could do it first thing in the morning. You could do it in the evening before you go to bed. A lot of people find it relaxing. You may have found that exercise to be sort of relaxing. That's not the point necessarily, but it is sort of a secondary benefit. So a lot of people like to do it, in the evening. There are a lot of other mindfulness strategies that you can use. If you thought that one was hokey or weird, you can pay attention to your breath, for 5 or 10 breaths without trying to change it, just noticing your breath in and out. You can notice your senses when you're taking a shower, and try to be really present to what that experience is like. Oftentimes when we're doing routine tasks like driving or taking a shower, we're not really thinking about what we're doing. We're sort of on autopilot while our mind goes somewhere else. And so the point of mindfulness is to just return your attention back again and again. So you could practice that in the shower, in the car. There's also a number of apps for mindfulness and meditation. Maybe you've already tried some and you have one that you like. That's great. Headspace is freely available to healthcare providers right now, so you could try downloading that if you haven't. There's also another good app called Insight Timer, and there's hundreds, if not thousands, of free mindfulness and meditation exercises on there. So I'll send this email or information out via email afterward. I also have created a 4-step guide for managing stress during this time. And if you haven't already received it, I'll make sure that you have access to that as well. So the next point I want to make in this is that it's really important that you take care of yourself during this time. I think as healthcare providers, we often think about taking care of other people first. And being a medical professional or a healthcare professional is a really noble endeavor. And I think often it comes at the sacrifice of one's own physical health and wellness. And so I think during this time, it's really important to remember that the only way we can be effective and that we can care for other people is if we're also caring for ourselves. It's not a message that you as physicians get a lot. And so I think that's sort of my role in making sure that you hear it somewhere because this is important. It may have to be done flexibly. So if you're a person who needs a certain number of hours of sleep every night, or you exercise at 5:30 a.m. only, it may not look the way that it normally looks. But I would encourage you to think about small ways that you can build in self-care during this time. So that may mean a number of different things for different people. Of course, it means making sure that you stay hydrated and you're drinking water, eating enough to maintain your energy, and getting some sleep. But it can also mean things like getting outside and feeling the sun on your skin, texting or calling someone that you love, going for a brief run or walk. Even if you're in the hospital, maybe it means running up the stairs just to get your heart beating again. Listening to your favorite song. It could mean a whole bunch of different things for different people. But the idea here is that you could find ways to take care of yourself, even in small moments that you have. So another important aspect of self-care is maintaining mood during crisis or during difficult times. And so there are ways behaviorally that you can manage your mood. You don't have to convince yourself that everything's going to be okay, or that you should put on a happy face and just grit your teeth and bear it. There are things that you can do each day that will naturally elevate your mood without you necessarily having to force it. So one of these ways is through connecting with other people. And I don't know if you've heard of Brene Brown or her books, but I think she is very wise. And one of her quotes is that connection is why we're here. It's what gives purpose and meaning to our lives. And that's really backed up by research. So, in this time of social distancing where we're physically apart from people that we love, I think it's important to remember that we can still maintain social connections in one way or another, and that it's critically important for us as humans to do that. So it's not an indulgence, it's actually a necessity. Another important way to maintain your mood during this time is to do something pleasurable every day. And that may mean eating something that you really love, you know, bringing tea bags from home from your favorite tea that you just really like the smell of, listening to your favorite music, um, doing something mindless that you enjoy, reading a little bit of a book each day. But it's really important to do something that you find pleasurable. And again, it can seem like, this is, superfluous or unessential during this time, but I can assure you that this is critically important to maintaining your sense of wellness. So the next thing that I would say is that it's important to reflect on why you got into this profession in the first place. What you're being asked to do is really hard, even under normal circumstances, with sleep deprivation and working around the clock and having attendings looking at your notes all the time and having a lot of pressure to get them done. And you didn't go to medical school to learn to write really good notes. You went to take care of people. And now with this current situation, sometimes the reasons why you got into this in the first place can seem really remote. Um, but my guess is that there's some element of what you're doing now that's consistent with your most important values as a person or as a doctor. And it can be really meaningful and helpful during difficult times to reconnect with those reasons. So on the slide, I have it as find your why, or why you're doing what you're doing. What I'm really talking about is your basic or most important values. So I want you to take a moment to reflect on them. Usually, I do this as an exercise with people. It takes about 20 to 30 minutes, and I didn't want to consume all of our time with this today. But if you can, if you have something to write with, that would be great. And if not, just think about it. But write down 3 values that guide you. And values can be things that are important to you, what you want to be remembered by, things that you stand for. So some examples are health, empathy, social justice, kindness, love, purpose, challenge. So write down, 3 things that come to mind. You don't have to be the most important to you, just what comes to you right now. And then think about or write down a few things that get in the way of you being able to enact those values in day-to-day life right now. Family might be another one. Friends. And I think one reason that, uncertain times make us feel so destabilized is that it feels like we're sort of pulled away from our most important values or the things that give us meaning in life. And so now I want you to think about what it would mean to you if you could honor these values every day, even through this crisis. How do you want people to remember you during this time? Then usually I have people set one goal for each of their three values, but let's, for the sake of ease and time, set one goal. And so psychologists talk about SMART goals, but essentially what these are we're trying to get specific. So if I value family, I would set a goal to do something specific with a specific member of my family or for a specific member of my family. Um, so if I have time with my kids, then, a goal could be that I try to be present when I read to my son at night, and spend a few minutes reading with him each day. He really enjoys that time, and so do I. So you notice that my goal was specific to read with my son, um, and it was measurable, meaning that I chose to do it for, let's say, 5 minutes a day. It's achievable. I wasn't suggesting that I would like take him to Disney World, especially not right now. It's realistic and targeted, meaning that it's specific to the value that I've selected. Um, so a lot of these things that you would ordinarily do to live in a way that's consistent with your values are not available to you right now, or won't be for very much longer. So you may have to think about outside of the box on this one. I do this with our inpatients on our perinatal psychiatry inpatient unit. And a lot of times it's hard because they value kids and relationships with their families, and they are distant from their families and can't visit them. In some cases, they aren't even able to call their kids. And so, in those cases, we think about setting goals that are achievable even during their inpatient stay. And that might include, doing a loving kindness meditation to send love to their kids, even though they're not with them right now. So you may have to think outside the box a little bit. All right, so I think I've done enough talking for now. I'd like to hear from you about ways that I can be helpful to you, either now, or you can feel free to contact me later. Um, here's my email address, and UNC School of Medicine has a bunch of wellness tools up on their website. The web address is very, very long, so I've shortened it here for you. I will make these slides available to you, so it's just one click away. But they have a number of resources and tools on their website. We are still running the Taking Care of Our Own program right now, which is really meant to support each of you during difficult times. So if you want individual therapy or coaching through this time, please don't hesitate to reach out. We're here to help. I'm also happy to have these discussions regularly with you all during this time. So if you find this helpful today, please let your uh, program administrators know, and we can do this as often as you'd like. All right, so I'm going to stop the recording now to take questions and have a discussion.